So it's been a little while since I did a video, but recently I've got like a lot of updates. So as you can tell from some of my previous videos, I suffered from chronic knee pain caused by severe Patella Alta, and which meant my kneecap was too high. It wasn't sitting in the groove. It was basically closer towards my thigh than it was my knee. So over the last few months, I actually managed to get this fixed surgically after basically after all the non-surgical treatments failed. So I went to see one of the surgeons in the country, and he's really good with this technique, and I ended up having a tibial tubercle osteotomy and an MPFL ligament reconstruction. So what that is just below your knee, so top of your shin bone, there's a piece of bone there, and that is where your patella tendon that connects to your kneecap is attached to the rest of your leg. What I had was this small piece of bone moved, and in my case it was moved downwards in order to bring my kneecap down into the groove. Because of all the damage that I had with walking and moving around with my kneecap in the wrong place, what happened was the MPFL ligament, which is on like the inner side of your knee that connects your kneecap to the inner side of your thigh, that obviously was getting damaged, so I had that reconstructed. So basically at this point in time, I'm 7 weeks post-surgery, so not too long, but long enough to know that whether it's going to work or not. And I will say now that at this point in time, I can only stand for short amounts of periods of times without going on my crutches. So if I move to my crutches here, I will, just to let you know, that's why. So yeah, basically what happened is I saw one of the best surgeons in the country. His name is Jonathan Eldridge. I've put his website and some actual medical details about the procedure in the description, but I was really grateful he was willing to do it, because I saw a lot of people locally. I find with cerebral palsy, if you have cerebral palsy, people are more reluctant to be able to do changes or surgical procedures, especially if you can walk already, because there's always a small chance that basically if you change any of the ligaments or anything in the leg, it may prevent you from walking because you've already learned to walk the way you have. But because I was in so much pain, I was on like codeine for at least 3-4 years. It was interrupting my sleep schedule. It was interfering with my daily life. I really wanted the surgery, and I was really pleased when I actually found someone who was willing to do it, and he had done it on someone with cerebral palsy before, which was a bonus. And I had to travel over 100 miles away from my home for this, but I am really pleased. So what happened before the surgery? I had gait analysis, I had x-rays, I had MRIs to this was actually a couple of years before the surgery. That's how long I was waiting since we discovered the issue, to how long it took me to find someone to do the surgery. So basically, a couple of years before, I had gait analysis to analyse how I walk. I went up to Oswestry for this, which is one of the known places for gait analysis and neurological disorders, especially with cerebral palsy. It's either there or Oxford, but I went up to Oswestry. And then after I had the gait analysis and the MRIs and all the other scans, it revealed the problem with my kneecap being too high. Sort of every time I bend and straighten my leg, moving in and out of the groove, which would be causing the pain. And it was also very unstable, so I couldn't put too much weight on it without it collapsing. And basically, yeah, so all of that, and I had to live with that for 2-3 years before I managed to find a surgeon to actually willingly take on the procedure, because I did a lot of reading on existing medical articles. I knew the risks. I knew what I was in for. I knew what I was in for recovery-wise. And what I was really grateful about my consultant and my surgeon who took this on is he understood that I did do all this before. I did understand what I was undertaking, and I did understand the risks. And he's one of the very few medical professionals I've talked to that actually spoke to me as a person and understood what I knew already about my condition. He knew what I knew, didn't go over things I already knew, and he it was just nice to be respected on a level of equal, rather than people go, oh, you've got cerebral palsy, you don't know what you're talking about, or they say, oh, we're just going to blame your cerebral palsy for everything. Yes, this may have been caused by the cerebral palsy, but it isn't the cerebral palsy itself. So it's really nice, it's really refreshing, and he was always really pleasant to talk to. And so what happened is I travelled up the morning of my surgery to the hospital, and basically I had a lot of pre-hospital checks, so the usual like blood pressure, compression socks, fittings, because I'll go over some of the risks in a second, but one of the risks for this is deep vein thrombosis, or DVT, because of the lack of mobility you're going to have. So I had to wear compression socks while I was in the hospital to reduce that risk from blood clots and DVT. I had that, and then very much most of the day of the surgery was just waiting around for the surgery, because I was one of the more complicated cases of the day. I was sort of put towards the end, because it kind of makes sense that you are put towards the end on a surgical list if it is going to be a bit more complicated. That way you don't hold up other people's time. So I was originally meant to go in at around 6:15 in the evening, I was told when I got there by the nurse, and I ended up actually going in about 3 hours earlier than that, so that was like really nice. I didn't have to wait around all day. It was a lot shorter. It managed my expectations, so that was brilliant. So basically on the day I was visited by both my consultant again, who I'd seen both virtually and in person. Here he went through the risks of the surgery again, which were obviously there's always the risk of death when you have surgery due to anaesthetic and how you think, so they have to mention that one. So there was also the risk of reduced knee pain, which I already had, so I didn't really consider it a big risk. Reduction of flexation in your knee, DVT, blood clots. So those were the major risks, and I understood all those, and I did actually get a lot of information beforehand, before the surgery, to say what things I could do to minimise those risks. Also on the day of the surgery, I was visited by the anaesthesiologist, and he was very nice. He asked me about all my previous experiences with anaesthetic, because obviously I've had knee surgery before, I've had a lateral release, I've had Achilles tendon lengthening, I've had all those before, and on both those times sort of anaesthetic via the vein didn't work out too well, so I was always gassed out, and I kind of spoke to him and said how I disliked that experience, because it is how I imagine death to feel like, because everything goes all echoey and distant, but you're still awake and you can still hear everything around you. So so I spoke to him about that, and he was really nice and said he'll try his best not to use gas, and he'll use injections and IVs through the veins if needed, and if he could. And in the end that did work, so that was brilliant. Like, it's the fastest I've ever been out on anaesthetic before, from what I can remember, so that was nice. I was also visited by the physiotherapist, who gave me a new pair of crutches, so these ones here. These little covers didn't come with it. I bought these off Amazon, because it used to be just wrapped in bandages, but eventually that gets uncomfortable, so I bought little padded covers. So I got these crutches. I did bring my own crutches to the hospital, but as I had those since I was 13, the bottoms were completely worn, and they were very slippy. I already knew that, so it was kind of nice to get a new pair of crutches. And they wanted to see how I walked currently. They wanted to teach me how to walk with the crutches once I'd had the surgery, because it's always good to do that before you have it. And then basically what I was also given is, as part of the surgery, for the first few weeks, because I had to restrict the movement, because obviously an osteotomy is a movement of the bone. What you don't want to do is do too much damage, do too much movement too quickly. So as part of that, I was given this range of motion brace, or ROM brace, and this went from thigh to basically near ankle and the middle here. So where you see these little lines here that are flagged with exterior and interior, that lines up with your knee, and what it does is it locks your knee into that position. So in this case, it meant I couldn't bend the knee for the amount of time that I wore this. I was meant to wear this brace for at any times when I was weight bearing, at all times during the first few weeks, because any damage to, or any sort of unneeded movement to both the osteotomy and the MPFL ligament reconstruction would have meant more damage. Possibly it wouldn't have been successful. So that was one of the hardest things to get used to, because I was kind of used to walking with the crutches. So yeah, they showed me how to put this on. So basically you've got little this side, you've got little clips here which you can undo and then do the size around your leg, and then you basically fasten them up by hooking these hooks to the other side, kind of like this. And one thing I did have to get used to was adjusting the size of the brace every now and then, because as I healed, my legs swelled up more, or as I healed more, then it didn't swell, so I had to tighten it. So that was one thing I had to get used to, as well as the quick release straps, which were useful when, say, I was resting and lying on the sofa and then needed to go to the bathroom, because it meant I had to put the brace on, which meant I had to give myself time. So yeah, that was an interesting experience for me. I've never really worn a range of motion brace before, but I can see how useful they would be, how helpful they would be. So this is what this is. So once it was time for my surgery, a porter, I can't remember the actual name, but for lack of a better word, came and got me, and I was taken down to the theatre part of the hospital via my bed. Here I saw the anaesthetist again, and I saw a couple of the surgical assistants in that room, and we had a chat. And from getting down to the sort of pre-room to the theatre, I remember looking at the clock just before I went out, got hit by the anaesthetic, and that was around 3:45. It's really good in hospitals, basically. Anywhere you go, there's a massive clock on the wall, so even if you've been out for a few hours, you can keep track of time. And then when I woke up in the recovery room, it was around around 5:30, 5:45. And then once I woke up from recovery room, I stayed there for about 15 minutes, half an hour, and then was moved back to my own hospital room at around 6:15. And then basically I was sleepy, drowsy and hungry for the rest of that day, because obviously I hadn't eaten that day because it was a surgical procedure that day. So I was given a post-surgery meal of a chicken sandwich and a chocolate brownie, and then I was just able to rest and given a lot of painkillers. One of the things I had during the surgery was a nerve blocker, and to be honest, it was quite an interesting experience, because I didn't know I had the nerve blocker until someone else pointed it out to me and just sort of tapped my leg. I was like, oh yeah, I can't feel that. That's why I'm not in as much pain. I was expecting it to be in much more pain. And to be honest, when that wore off, it was painful, but it was definitely a different pain experience to the one I'd previously been experienced constantly, day in, day out. It wasn't as constant, it wasn't as nagging, and I knew there was a good, for lack of a better word, reason behind it, that it was surgical pain. It was getting better, it was healing. This was to be expected, so that was good. Shortly after the surgery, like shortly after I came back from my room, I think it was only about 15-20 minutes after my consultant came up to see me and said that it all went well. There was nothing unexpected in there that he saw. It was all what he expected, which was good. And then he asked if I had any questions, but at that point I was wearing off anaesthetic, I was hungry, I was on painkillers, so by that point I wasn't that cognitive, so I just went, nah. There was probably a couple of questions after that I thought of, but I have now asked them now since I've seen him, so that's always good because he's always been nice and let me email him or talk to his secretary so I could pass on the questions and then he'd get back to me in a timely manner. So after the surgery was when like the main hard work, as you expect, begun. Basically what happened the day after this it was only an overnight procedure. I was meant to be discharged the next day. I was visited by the physio again, who basically then before they could release and discharge me, I had to take some steps and do a set of stairs because I had stairs at home before they could safely discharge me. So what this meant is it was the first time putting on the brace, first time using the crutches, and to be honest, I walked about 10 steps and that was extremely hard work before I felt really dizzy and faint and my blood pressure went down really low. And apparently that's quite common after anaesthetic, but at that point I was really frustrated, like it's only 10 steps, it's this hard, what have I done to myself? I didn't regret the surgery because I knew this was going to help in the long run, but I thought this is actually a lot harder than I expected. Like I knew it was going to be hard. And but after some time, after I'd rested, it was also a really unexpected hot day and the hospital didn't have air conditioning and it had safety latches on the window, so that probably didn't help with my dizziness and my faintness. But after a little while, after I got my levels back up and had a rest, I was able to walk again and do the steps, and the second time it wasn't as hard because I knew what to expect. So that's kind of my lesson learned from that. The first time's always going to be hard, the next times after that are not. Obviously I lived more than 100 miles away from this hospital that I went to, so what happened was basically my parents picked me up the next day. Because of COVID restrictions, nobody was allowed in the hospital, so it was my first time in hospital by myself. And to be honest, the hospital made it a really sort of as much as a pleasurable experience as they could. So essentially, like nurses came and checking on people, chatting on me, making sure to ease any anxiety. And for my first experience in hospital alone, it was a really nice one. So I am really grateful for that. To get home, I basically had to lie on the back seat of my parents' car with my knee locked in this brace, and we had to stop every so often to move around, obviously to reduce the risk of blood clots and like seizure in the joints. So that was interesting because getting in the car was interesting, even small steps that you don't, I guess what I could say now is sort of take for granted the little lips indoors that are used to block out water and things. Those were really hard to get over the first few times. So basically, I travelled home and I went to stay with my parents for a few weeks because obviously with the brace and lack of movement on crutches, I was basically using 3 limbs to walk, or basically 4 limbs to walk, and I had no free hands, so obviously couldn't look after myself too much. So I went to stay with my parents for a few weeks, had some time off work, and that was interesting. It was kind of nice, to be fair. I'd never really had a big break from work since I started joining, so it was kind of nice to have the break. There was hard work. I received some nice flowers and nice cards from my colleagues, which was a lovely surprise. Though I probably should have guessed when they asked me for the address of my parents' house where I was staying. It's like you don't randomly ask for that. But it was really nice. It made me feel warm inside. And that's sort of when the hard work began. Obviously I had the range of motion brace. I also had to do small amounts of physio, like ankle pumps, building up the muscles in my quadriceps in order to help with the movement, also included things like pushing down and pushing up, that sort of thing. So that was for the first couple of weeks. After the first couple of weeks, I was allowed to remove the brace and begin to walk without it. The first time was definitely interesting because I felt really unstable, and for the week after I was allowed to remove it for walking, I actually still used it on stairs because I didn't trust my own stability. But after a week or so, I got used to it. I have had a few falls since the surgery. One was the day I got home, but the brace did its job and I basically just fell backwards, like straight on my bum. So it hurt that, but it didn't do any damage. Another one was basically a few weeks after I'd removed the brace, and basically I was on the stairs, I felt my balance go, and I accidentally shoved all the weight through my left leg, and that was painful. And then another one was not the Friday just gone, but the Friday before that, I had an actual fall, and that was actually one of the most painful experiences I've ever felt because I landed directly on the surgical site. And yeah, I had to call a friend to come help me, and that was lovely because they spent like the whole weekend with me to make sure I was okay, as well as taking me to A&E for an emergency scan. So yeah, that was all good. Physio now, I'm still doing light touch because what my consultant emphasises, because of the cerebral palsy and because of how I walk and all the spasticity in my muscles, is to do a cautious approach. We don't want to do too much at once. That could damage the surgical site because of muscle spasms amongst other things. And yeah, so I've been doing light touch, been going small walks. As and when I can, I've been doing physio, so trying to increase the range of motion with my knee. So now, after the surgery, I could get my leg fully straight, which I hadn't been able to do before. And then right after the surgery, I got to around a 60-degree bend, which was quite painful to get there. But now, so I'm at week 7, I can get past 90 degrees, which is about the same as I was before the surgery because I had limited movement there. So I'm definitely on track. Yeah, and now I guess sometimes I get frustrated with what I perceive as a lack of progress. Like I feel like I'm not feeling quick enough, but I'm actually medically on track for what I need to be. I've got enough range of motion, I've got enough movement, so I've just got to be cautious and not rush myself because that's why I fall over. So I've got to really take that message to heart and not sort of hold myself up to really strict standards that nobody else is expecting of me. Yeah, so after the surgery, I'll put some pictures either up here if I can be bothered to do the editing, or right at the end of the video of how my leg looked and developed after the surgery. So we'll start with just before the surgery, what my knee looked like and what was moving, to all the bruising and all the swelling that developed, to what the scars are looking like now. And by now my scars have healed, so there are lines there. I kind of like the look of the scars, to be honest, but they're no longer open, so it's just scars. Yeah, and I will also show you the x-ray of what my knee looks like now, because in my knee, in order to hold this surgery in place, I've got a small metal plate around 3 screws into the bone, and then another one sort of on the inner side of my knee to hold the MPFL ligament reconstruction in place. All in all, I'm really grateful for having the surgery. I know I was really lucky to have the opportunity, and minus any falls, my pain is reduced to about 10% of what it was before the surgery, which is like a really good thing. I wasn't never expecting to be pain-free, because cerebral palsy means you're in pain all the time, but being back at 10% is nice because it means you can do so much more. I am sort of looking towards the future now instead of just existing day by day. I'm looking into doing my master's degree, so hopefully I'll get support from work from that, and I'll let you know how my progress grows. But at the moment, I'm just focusing on small steps and walking. I guess one of the things I have realised is how much effort I put in prior to the surgery of trying to keep myself upright with an unstable knee. I'd forgotten how nice it feels to be able to put weight into your knee and it not want to completely collapse around you. So that is one nice thing, and how much easier sometimes it is. I don't have to think about that. Obviously with surgery and everything else, fatigue is hitting me quite a lot at the moment, so I'm trying to manage that, but I think I'm doing okay. But overall, I'm really glad I had this surgery. It has really helped me so far, even with the falls, and my surgeon was really pleasant, and he respected me and my own intelligence at that level and always talked to me as a person. So that I'm really grateful for, and I'm hoping that this surgery I've had will last for a few years, if not more, and then I know that things are not going to be endlessly in pain. Well, at least not from this. I've got other cerebral palsy issues, but that's just day-to-day life. So thanks for watching. I'll see you in my next video.